So we just had an outstanding session about the use of artificial intelligence in oncology and in the clinic. And so we wanted to spend a little time today talking about what that is. So can you tell me a little bit about where you think there are some limitations to how artificial intelligence can be used?
Right. So artificial intelligence, including large language models, are great at what's called in-context learning, which is generating useful information that could be a summary or it could be detailed information or knowledge. The problem is those large language models have been trained on the internet and they're inherently biased based on the information that is read on the internet. They also hallucinate. It's just how the technology works. So it really does have some severe limitations, but it is still a very powerful technology that has a lot of great opportunity for making our jobs better and easier.
Yeah, so as a medical oncologist, I like the making our jobs easier part. I think there's a lot of interest in how we can leverage these technologies to make the work of day-to-day clinical care easier, how to be more informed about the decisions we make, and how to be more timely in our responses to patients. I did hear some concerns voiced in the session about are clinicians going to be cut out of the patient care process by the increasing use of technology. I don't know if you have thoughts about that.
Yeah, fundamentally, I see this technology as an amplifier or an augmenter or an assistant to knowledge workers and experts like physicians and pathologists. And that technology can make their jobs faster and easier by bringing up relevant contextual information, synthesizing vast amounts of information to help make decision-making simpler. But at the end of the day, they're assistive technologies. They're not replacement technologies. They do tasks, individual tasks really well. They do not do jobs completely. So really, I see that those technologies plus fundamental existing information technologies like databases and EHRs working in concert with the providers, the clinical trial navigators, and large language models for just really maximizing the opportunities for treating our patients.
Yeah, and I'd love to talk more about how we kind of leverage these models, but do it within our existing healthcare infrastructure. A lot of the important work that's being done in this space is happening external to our electronic health record systems. And we are, I think, challenged, and the advancement in this space is slowed down by the fact that the data are outside of the platforms that we use for clinical care. So I think that's a major challenge to the adoption of these technologies, is that we have patient data in electronic health record systems, but to export those data into big data platforms or private companies, there are a lot of kind of regulatory or legal hurdles to overcome with that. So how do we leverage technologies, synthesize the data that are in the EHR and feed them back to clinicians without violating privacy laws and some of the limitations that are there?
Yeah, currently, there are a couple of options there. One is the platform providers themselves, the cloud providers like Azure from Microsoft and Amazon and Google. They're able to host that information in a secure network so that your data never leaves that secure private cloud. And then another really powerful opportunity is what are called small language models or open weight models that you can actually download and fine tune on your institution's information, and then apply it directly to your workloads, and that allows the institution to have real control and making sure that none of that data is leaving their institution. But it's very early days, and we're just starting to learn how to work with these things to solve these really important problems.
Yeah, I could see one advantage of the small language approach, or the kind of in-house or embedded approach, being the ability to keep identifiers within the data set. So one of the concerns is that if you have to de-identify the data to send it out, and then you get de-identified data back, it's awfully hard to use that to personalize care planning decisions for the patient in front of you. So I could see how that would be very useful.
That's great. And we had a great conversation. We had two patient advocates with us today, and then questions from the audience as well about these biases and hallucinations and other challenges. Were there any other key takeaways that you had from that conversation?
Yeah, I think it was great to hear from so many patients, both on the panel and in the audience. I think it's important for us to remember that patients are already leveraging the technologies that exist. Someone mentioned a patient who put all of their own personal medical records into, I think it was Chat GPT, and got some recommendations back. Some were on target, some were kind of off base. But it's important for clinicians to understand that patients are going to use publicly available tools. And so we need to have some awareness of that and some preparedness in responding to the questions that might arise from our patients in that space. I think there's also interest in how AI could be leveraged to respond to patient concerns. That was something that was raised by an audience member, including when patients get new results in their patient portal. Many times those are confusing to interpret, and could we leverage technology to interpret those test results for patients without the need for clinician involvement, which can often slow down the process. There are some challenges with that. The AI might misinterpret the results as well, and then create more distress for patients. But I do think there are some interesting opportunities there, and I'm excited to see where things go with this.
It was a great conversation. I hope you'll check it out.
Yeah, thank you.